Okay, grade 12. So in the winter school session number 2 today, I made, well, actually afterwards, because my iPad wasn't on, I made 2 videos about the endocrine system, and I still want to go over the diagrams that are at the end of your table notes. So we look here. I was trying to draw a simple diagram of the brain on the board. And there's the gray matter, and there's the white matter, there's the spinal cord, and at the base of the brain, that region of the white matter is called the hypothalamus, and attached to it is the little stalked pituitary gland. That's what it looks like, more or less. It's got 2 anterior and a posterior lobe, and then obviously this is anterior, that's posterior, so we need to switch this little diagram around. And the anterior pituitary, but you don't need to remember that, secretes growth hormone, so it results in normal growth. But if there's over-secretion in children, then they could become really, really tall, like up to 7 meters. And usually it's caused by a benign, non-cancerous tumor on the pituitary gland. And on TV recently, I watched a program about an 8-year-old boy who had this. He was nearly 7 foot, and eventually they live in poor countries, so they often, it often doesn't get picked up, and they don't, have tests to see what's wrong. And eventually he did go for scans, and they saw it was a pituitary tumor, and eventually went for surgery, and they removed it. And a few weeks after his operation, they saw that the levels of growth hormone in his blood had decreased. But if it's picked up early enough in children, they can get medication. Now, they grow taller because the growth plates, remember the long bones that we learned about in grade 10? All right, so the growth plates, the regions in the head region of the long bone where mitosis occurs to make the bones grow longer, those become closed in adulthood. So you don't grow tall anymore. So if there's an oversecretion of growth hormone in adults, then they get a disease called acromegaly. Now, I see that I haven't got this in the diagram at the end of your notes. So this is where the bones, especially of the hands, the feet, and the face, you can see how this lady's facial features change as a result of acromegaly. And you can see the very large hands and very large feet, and they become deformed, and joint deformities, leading to, sometimes they become wheelchair bound, can't even walk anymore, okay? So that's oversecretion of growth hormone in adults. Okay, let's just go back to the diagrams. Okay, whoops, wrong one again. Let me just go back. Where am I now? This one. Ah, there we go. This one. Okay, sorry about that. So oversecretion in children, grow as they grow up, and then oversecretion in adults, acromegaly. But an undersecretion of growth hormone, it could be genetic. There's a number of genetic mutations. They have normal sized torsos and head, but their arms and legs are disproportionately smaller. So that could pass along in families, and you often, there's lots of programs on TV about families. Then the thyroid gland, remember it's that butterfly-shaped gland that sits in front of the trachea below the larynx. Okay, so I've seen that being asked in a past paper. And this gland is, remember, the pituitary gland secretes thyroid-stimulating hormone, which then causes the thyroid gland to secrete thyroxine. So you can get an under or over secretion of thyroxine. So an under secretion in children is called cretinism. There was a question, often this pops up in papers where you have to match the columns. So an under secretion of thyroxine, slow metabolism in children. You can see they look rather puffy, large tongue, very tired, listless. And in adults, in women, say in their late 40s, 50s, an undersecretion results in something called myxedema, low metabolism, swollen eyes, swollen tongue, etc., difficulty remembering, that kind of thing. All right, but then you can also get an oversecretion. So if you look here now, this is called hypothyroidism, but an oversecretion is called hyperthyroidism, where they produce too much thyroid hormone, thyroxine, and one of the symptoms is exophthalmic goiter. You don't need to remember that. in both cases, under or over secretion, there can be a goiter of the neck, so the actual thyroid gland, which isn't functioning properly, can swell up. And this can also be due to a lack of iodine, because if you don't have iodine in your diet, then your gland, the thyroid gland, can't make thyroxine, and then the gland swells up. All right, so this often, hypothyroidism often happens in women. It's more common in women, say in their 50s, and it can be treated with antithyroid medication or even surgery, but that's usually not the case because that's quite dangerous. But they can also give radiation therapy, where they destroy some of the tissue of the thyroid gland so that it produces less thyroxine. Then you've got the adrenal glands, so triangular shaped glands on top of each kidney with an outer cortex and an inner medulla. And the, let me see you now. So if you remember, the adrenal glands secrete adrenaline. That's one of the hormones known as the fight or flight hormone. And it's going to cause increasing heart rate, blood pressure, breathing rate. Brain function is better, muscles are going to work better to help you to either get away or stay behind and fight. Okay. Then the pancreas. So there's the pancreas sitting, below the stomach in that little curve of the small intestine. This is the spleen. And there's a little tube leading from the pancreas, pancreatic duct, into the small intestine. So the exocrine cells of the small intestine secrete enzymes, which help with digestion in the small intestine. But in terms of hormones, remember the pancreas is an endocrine gland. So the islets of Langerhans, little patches of cells, secrete insulin and glucagon. And some of the cells secrete insulin, and the beta cells secrete insulin, and the alpha cells secrete glucagon. All right. Then your basal metabolic rate, so the thyroid gland, remember this one over here, it secretes thyroxine, and adrenaline controls how fast or slow things work in your body as well. So your basal metabolic rate is the energy that your body consumes when it's at rest. So for example, when you're sleeping, to keep you alive, okay, to keep things happening, breathing, heartbeat, things, ions moving across membranes, making proteins, whatever the body needs. So when you're a child, the basal metabolic rate is much higher, and there's lots of growth in that going on. And you can see how the basal metabolic rate decreases in both males and females, up until about age 20, and then it stabilizes. Then from about age 40 onwards, it starts decreasing again. And males generally have a higher basal metabolic rate than females because they've got more muscle mass compared to the ratio of fat tissue. And then there's different factors that can result in a decrease of basal metabolic rate. Like if you don't eat enough, then you don't have enough, food for energy. Bad nutrition as well. So fasting, bad nutrition, lack of sleep. When you are sleeping, your metabolic rate decreases. And things that increase basal metabolic rate, eating food, adrenaline secretion, hot temperatures, exercise, and stress, that all raises your metabolic rate. So the thyroid gland secretes more thyroxine. All right, then negative feedback. So this is the way that the body naturally controls lots of things. Water in the blood or in the body tissues. Remember, we call it homeostasis, keeping everything within narrow upper and lower limits. So oxygen concentration, CO2 concentration, temperature, pH, amounts of glucose in your blood, etc., etc. So the levels of those substances, all or body temperature, it's all around an average. And then if it's too high, then there's a corrective action to bring it back to normal. If one of those factors is too low, detected, and a corrective action is brought about to return that factor back to normal. So that's negative feedback. So just quickly looking at TSH and thyroxine. So remember, the pituitary gland secretes TSH, thyroid stimulating hormone, which stimulates the thyroid gland to secrete thyroxine, which controls metabolism in the body. So there's an upper and a lower limit of the amount of thyroxine in the body, and it changes all the time, but it's controlled, homeostasis. So if the level of thyroxine is too high, because the pituitary was secreting thyroid stimulating hormones. So the level of thyroxine in the blood increases. So then that is detected by the pituitary gland, which then secretes less TSH, not really stop. So then TSH concentration in the blood drops. So the thyroid gland is stimulated to secrete less thyroxine, and then the level of thyroxine is brought back to normal. Then it might be too low, okay? So if you're in a very cold environment, for example. So think of going from a sauna where your metabolic rate goes up high, and then maybe going into a very cold region, like falling into a frozen pond. So now the concentration of thyroxine is low, so it's sensed by the pituitary gland, blood passing through the pituitary gland, and the pituitary gland secretes less TSH. Concentration of TSH in the blood is now lower, therefore the thyroid gland secretes more. The pituitary gland starts making more TSH because thyroxine in the blood is low. So then TSH causes the thyroid gland to secrete more thyroxine. The metabolism goes up and thyroxine levels therefore go back to normal. Okay. Then negative feedback to control the concentration of water in the blood. So that's by means of ADH. I'll make this a bit bigger. So ADH is also secreted by the pituitary gland. And when you're dehydrated, your body needs to save water. So ADH travels in the blood and affects all the hundreds of thousands of nephrons in the kidneys, and causes the distal convoluted tubule and the collecting duct to become more permeable to water, so that more water is reabsorbed back into the blood. All right, so you can see how water is reabsorbed into the blood vessels. Then you make less urine, which is hypertonic. That just means it's got more salt. So it's going to be darker yellow and less urine. And then the blood concentration goes back to normal because the water is reabsorbed back into the blood. Okay, but then if you don't have enough water in your blood, if you have too much water in your blood, the blood is too watery. So therefore, the pituitary gland secretes less ADH. So therefore, there's less reabsorption of water from the nephrons into the blood because the blood is too watery. So more water is released in the urine, and you produce lots of very dilute urine, and then the water concentration of the blood returns to normal. Then lastly, the homeostatic control or negative feedback control of glucose in the blood. So if you eat a meal, the blood glucose concentration increases. Then the beta cells in the islets of Langerhans secrete insulin. Insulin in the blood increases, causes the cells in your body to take up insulin and excess glucose to be converted to glycogen and even fat. And glycogen is stored in the liver and the muscles. And then the blood glucose level goes back to normal. But then maybe you haven't been eating for a whole morning or whatever, and you start feeling the shakes. The blood glucose concentration is dropped. That's detected. And the alpha cells in the islets of Langerhans in the pancreas secrete glucagon. A for alpha, the glucose is gone, the blood glucose is low. So therefore, glucagon's concentration in the blood increases, and it causes the liver, or glycogen in the liver, to be broken down into glucose, and that glucose is released into the blood, and the blood concentration returns to normal again. So please, there weren't enough questions in the text, in the test. So you really need to go and work through all these questions, and lots of them, and you'll find the answers on Moodle and even Google Classroom. Lots and lots of questions, even an extra one and a summary and so on. So please make sure you work through all of that and go through past papers to practice questions on the endocrine system. All right, so that's the end of my little story, my revision of endocrine system.